But in September, the JCVI did express concerns about a child vaccination programme because of uncertainty regarding the magnitude of potential harms. Following advice from the CMO, the government pushed ahead with the mass vaccination of healthy children on the basis that while the benefits to children's health were marginal, it may reduce transmission and keep kids in school. Around 50% of 12 to 15s have now been jabbed. So what assessment has been made of the effectiveness of the vaccination programme in keeping children in face-to-face education? Now that the Omicron variant is dominant and more evidence is available, the benefits and risks of vaccinating children may have changed. So what assessment has been made of the risk of hospitalisation of healthy children due to Omicron compared to Delta? Evidence is emerging that vaccination has minimal impact on Omicron transmission. So what reassessment has the government made of the potential future impact of child vaccinations on reducing transmission in schools? And given a recent CDC study showing that the risks of myocarditis in young people following vaccination may be greater than previously thought and compounded by multiple doses, will the government urgently review the potential harms of vaccinating children? This weekend, the NHS put out a press release encouraging more children to get jabbed, including the lines, "Young people can get their life-saving protection and vaccines will protect young people from Omicron." Where is the evidence for these claims, and does the Minister believe that this communication meets the commitment not to put pressure on children? And lastly, given the evidence on transmission, will the government push ahead with the compulsory vaccination of NHS staff? Will it insist on a booster dose for all staff every few months? And if not, where is the evidence that compulsory vaccination of staff will increase patient safety in the long term?
Minister.
Thank you, Mr. Speaker. And I think that my honourable friend is quite right to raise some of her concerns. And I think we need to start from scratch, remembering that it's the MHRA, which is the highly thought of regulator, that has deemed that the vaccine is safe for this age group. And then as a result of that, the JCVI are providing their recommendations, and also our chief medical officers across all 4 nations add into that. And already the vaccine has been given to millions of 12 to 15-year-olds in a number of countries, including 8 million in the United States. And data from these countries shows that the vaccine has a good safety record. And I'm completely confident that the JCVI would not be making these recommendations if they've got any doubt at all. And that's why all eligible 12 to 15-year-olds are able to book their second jab, is it's the best way to protect these young people and to make sure that they're kept in education, as we all know that having that face-to-face education is one of the most valuable things that we've all begun to accept, and we're doing whatever we can to keep them in that position. I think we must also recognise that myocarditis does occur as a result of COVID infection as well, and we need to get that balance right to make sure that we're doing whatever we can to protect the majority of young people, to make sure that they are kept in education in a timely manner. I think it's quite right that we continue to follow the scientific evidence, the clinical advice that we have done throughout this pandemic.
We now come to Shadow Minister Andrew.